Today, we uncover the hidden science of amniotic fluid, its measurements and its types, functions. Let's talk about amniotic fluid, an essential part of every pregnancy. Amniotic fluid is the fluid that fills the amniotic sac and surrounds the developing fetus. It acts as a protective cushion and provides the baby with a safe environment to grow and move. A normal amount of amniotic fluid is very important. It helps with fetal development, especially the growth of the lungs, the musculoskeletal system, and overall well-being of the baby. This fluid is usually pale yellow and clear in appearance. The volume of amniotic fluid changes throughout pregnancy. It gradually increases as the fetus grows and varies according to the gestational age. Understanding amniotic fluid is the first step toward interpreting many obstetric ultrasound findings. Now, let's look at the contents of amniotic fluid. Amniotic fluid is not just plain water. It is actually a solution containing various suspended materials. Within it, we find fetal epithelial cells along with a balanced mixture of organic and inorganic salts, all dissolved in a fluid that is about 98 to 99% water. When we talk about its organic components, about half of them are proteins, which play important roles in fetal growth. The remaining half includes carbohydrates, fats, enzymes, hormones, and even small pigments. These elements reflect ongoing fetal activity and development. Understanding what amniotic fluid contains helps us appreciate why changes in its volume or composition can be clinically significant during ultrasound assessment. As the pregnancy progresses, the composition of amniotic fluid gradually changes. This is because various forms of fetal excreta, such as fetal urine and occasionally meconium, begin to mix with the fluid. These additions reflect the baby's growth and the increasing function of fetal organs. Since a major contribution to amniotic fluid is fetal urine, the fluid becomes a useful resource for medical evaluation. Through amniocentesis, specialists can analyze the amniotic fluid to study fetal enzyme systems, amino acids, hormones, and many other important substances. These tests help in assessing fetal health and identifying certain conditions long before birth. Recognizing how the amniotic fluid changes over time gives us deeper insight into both normal development and potential abnormalities. Now, let's move on to the functions of amniotic fluid, which are essential for healthy fetal development. First, amniotic fluid provides a supportive medium that allows the fetus to grow and develop symmetrically. Because the fluid surrounds the baby evenly, it prevents pressure on delicate fetal tissues and helps maintain proper shape and structure during development. It also gives the fetus the freedom to move its limbs comfortably, which is important for developing muscles and joints. These early movements inside the womb play a major role in shaping the musculoskeletal system. Another vital function is protection. The fluid acts like a soft cushion, absorbing shocks and helping to protect the embryo from any mechanical injuries that might occur from outside forces. Together, these functions highlight just how important amniotic fluid is in creating a safe and supportive environment for the growing baby. Next, let's discuss the source and regulation of amniotic fluid, which changes throughout pregnancy. In early pregnancy, most of the amniotic fluid is formed from the mother's blood, passing through the fetal membranes. This early fluid helps create the initial environment for the embryo. As we enter the second trimester, the fetal kidneys start functioning, and fetal urine becomes the major contributor to amniotic fluid volume. Because of this, the amount of fluid continues to increase as pregnancy advances. Amniotic fluid is continuously formed and reabsorbed, maintaining a dynamic balance. In fact, the entire volume is replaced roughly every 3 hours, showing how active this system is. It's estimated that the fetus adds around 500 milliliters of urine per day to the amniotic fluid. At the same time, fetal swallowing begins around 11 to 13 weeks of gestation, and by mid-pregnancy, the fetus swallows about 400 milliliters daily. This cycle of urination and swallowing is essential for regulating fluid volume. Amniotic fluid also plays an important role in lung development, helping the fetal lungs expand and mature properly. Understanding these sources and regulatory mechanisms helps us interpret amniotic fluid findings during ultrasound. Now let's talk about amniotic fluid volume, often referred to as AFV. As pregnancy progresses, the amount of amniotic fluid increases gradually. This slow rise supports the growing needs of the fetus and reflects the balance between fluid production and absorption. The amniotic fluid volume typically reaches its peak around 36 weeks of gestation. After this point, the volume naturally begins to decrease as the pregnancy approaches term. This decline is normal and expected. Because fluid levels drop after term, oligohydramnios, or decreased amniotic fluid, becomes more common in post-term pregnancies. Studies have provided approximate reference values for AFV at different stages. Around 25 milliliters at 10 weeks. About 350 milliliters at 20 weeks. Reaching roughly 1,000 milliliters at 35 weeks. And then falling to around 250 milliliters by 43 weeks. These numbers help clinicians assess whether fluid levels are within the normal range during ultrasound examinations. Now let's look at how amniotic fluid appears on ultrasound, which is an important part of obstetric imaging. In the first trimester, amniotic fluid usually appears anechoic, meaning it looks completely black and echo-free on the screen. This is the normal appearance. If the fluid looks unusually echogenic in the first trimester, this is rare and can be an indirect sign of acrania or anencephaly, because floating tissue or debris may be present when the fetal skull is absent. As we move into the second and third trimesters, the amniotic fluid may show some internal echoes. These are usually caused by vernix caseosa, which consists of small flakes of fetal skin mixed with protective substances that naturally float in the fluid. Near term, another source of debris can appear, meconium, which the fetus may release into the amniotic fluid. This can make the fluid appear more echogenic or cloudy on ultrasound. Understanding these normal and abnormal appearances helps us interpret the condition of both the amniotic fluid and the fetus. There are two standard methods for evaluating amniotic fluid. The first is the single pocket method, also called the maximum vertical pocket. In this method, the sonographer identifies the largest pocket of fluid free from fetal parts and umbilical cord and measures its vertical depth. The second method is the 4-quadrant amniotic fluid index, commonly known as the AFI. Here the uterus is divided into 4 quadrants, and the deepest vertical pocket in each quadrant is measured. These 4 measurements are then added together to estimate the total amniotic fluid volume. Both techniques are widely used and help determine whether the fluid level is normal, decreased, or increased. Now let's talk about the ultrasound assessment of amniotic fluid, especially in the early stages of pregnancy. In the first trimester, the assessment focuses on estimating the amniotic fluid volume, which is closely correlated with gestational age and the crown rump length, CRL. At this stage, fluid volume helps confirm normal early development. To make this estimation, the sonographer measures the 3 widest perpendicular diameters of the amniotic sac. These measurements are taken in different planes, length, width, and depth. By combining these dimensions, an approximate fluid volume can be calculated. This early evaluation provides important information about the environment in which the embryo is developing. Now, let's talk about how amniotic fluid is actually measured in the first trimester. Once we obtain the 3 widest perpendicular diameters of the amniotic sac, D1, D2, and D3, we use them to calculate the approximate fluid volume. There are 2 commonly used formulas. The first is the geometric formula, 4/3 pi multiplied by half of each diameter, or 4/3 pi times D1 half times D2 halves times D3 halves. For easier clinical use, this formula is often simplified to 1.57 times D1 times D2 times D3. Both formulas provide a reliable estimate of the amniotic sac volume in early pregnancy. This calculated volume helps verify normal development and ensures the embryonic environment is appropriate for growth. As we move into the second and third trimesters, evaluating amniotic fluid volume becomes a routine and very important part of obstetrical ultrasound. At this stage, the main goal of assessing AFV is to identify fetuses who may be at risk. Abnormal fluid levels, whether too low or too high, can be associated with certain congenital anomalies, placental conditions, and complications that may affect fetal well-being. By carefully measuring the fluid volume, we can detect early signs of conditions that might require closer monitoring or changes in the management of the pregnancy. This routine evaluation helps ensure that any potential concerns are recognized early and addressed appropriately. Now let's look at the single pocket method, one of the simplest and most commonly used ways to assess amniotic fluid. In this method, the sonographer searches for the largest pocket of amniotic fluid that is free from fetal parts and the umbilical cord. Once this clean pocket is identified, its vertical depth is measured. A measurement between 2 and 8 centimeters is considered normal. Values below this range may suggest oligohydramnios, while measurements above it may indicate polyhydramnios. This quick, reliable technique is especially helpful during routine scans and in situations where a rapid assessment is needed. Now let's move on to the 4-pocket method, also known as the Amniotic Fluid Index, or AFI. In this technique, the uterus is divided into 4 quadrants using the maternal midline vertically and the umbilicus horizontally. In each quadrant, the sonographer measures the largest vertical pocket of amniotic fluid that is free of fetal parts and umbilical cord. These 4 measurements are then added together to calculate the AFI. When interpreting the results, an AFI of less than 5 centimeters indicates oligohydramnios, meaning decreased amniotic fluid. A normal AFI ranges from 8 to 18 centimeters. An AFI greater than 18 centimeters suggests polyhydramnios, or excess amniotic fluid. Let's summarize the pattern of amniotic fluid volume, or AFV, throughout pregnancy. As the pregnancy progresses, the amniotic fluid volume increases gradually. This steady rise supports fetal growth and reflects the balance between fluid production and absorption. The volume usually peaks around 36 weeks, reaching its highest level, and then begins to decrease as the pregnancy approaches term. This decline is normal in late pregnancy. Here are the typical reference values. About 25 milliliters at 10 weeks. Around 350 milliliters at 20 weeks. Reaching approximately 1,000 milliliters by 36 weeks. Then decreasing to about 250 milliliters by 40 weeks. These values help clinicians identify whether the fluid level is within the expected range and guide the evaluation of fetal well-being. If you want to continue, oligohydramnios is defined as a reduced amount of amniotic fluid. This decrease can limit fetal movement, affect growth, and may signal an underlying condition that needs careful monitoring. When the reduction becomes extreme, it is referred to as anhydramnios. Anhydramnios means there is no detectable amniotic fluid pocket on ultrasound examination. This is considered a severe form of oligohydramnios and requires immediate clinical attention. Let's go over the most common causes of oligohydramnios, which simply means the amniotic fluid volume is less than about 400 milliliters. One frequent cause is postterm pregnancy. As the pregnancy goes beyond the due date, the placenta begins to age, and fluid levels naturally drop. Another serious cause is chronic fetal death, where fetal activity and urine production come to a halt, resulting in very low fluid levels. A major structural cause is renal agenesis, which means the fetus has failed to develop kidneys. Since fetal urine contributes most of the amniotic fluid in the 2nd and 3rd trimesters, kidney absence leads to severe oligohydramnios. Premature rupture of membranes, where the membranes break early and fluid leaks out, is also a common cause. Oligohydramnios can also occur with advanced intrauterine growth restriction, where reduced placental function limits fetal urine output. Additionally, abnormalities of the fetal genitourinary tract, conditions that reduce urine formation or flow, can contribute to low fluid levels. One example is infantile polycystic kidney disease, which affects kidney function and leads to decreased urine output. Understanding these causes helps guide diagnosis, management, and counseling during pregnancy. Now let's discuss polyhydramnios, sometimes called hydramnios, which refers to an abnormally increased amount of amniotic fluid. Polyhydramnios is typically defined as an amniotic fluid volume greater than 2,000 milliliters. This excess fluid can stretch the uterus, affect fetal position, and may be a sign of underlying fetal or maternal conditions. In general, the more severe the polyhydramnios, the higher the associated prenatal risk. Severe cases are linked with increased prenatal mortality, meaning the prognosis for the infant can be poor when fluid levels rise to extreme levels. Recognizing polyhydramnios early allows clinicians to investigate its cause and determine the best management plan for both the mother and the fetus.